Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about how to sequence your health information or medical coding certifications. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay guys, so when it comes to representing yourself in the health information industry, how you represent yourself says a lot about what you know, what your competencies are, and the level of your education, okay? And so whenever you are representing yourself and you have your name and you have your credentials right after your name, there's many ways we can go about becoming certified and all the certifications that we can get, all right? So the thing that you have to know is this: you have to be truthful when you are representing yourself and your name. And you have to be able to, when you are showing your name and you're showing your credentials, these credentials have to be possessed. You cannot be eligible, it cannot be in process, and you put it on your name. You can never do that. That is wrong and it is misleading. And that is the worst thing that you can do, especially in a field that thrives itself on integrity, okay? Each person must have integrity and must be truthful and honest. This passage comes from the AHIMA Code of Ethics, which applies to all health information professionals, regardless of affiliation, okay? They are the leader. AHIMA is the leader when it comes to this. And here is the Code of Ethics, and it is number 11 specifically. It says, state truthfully and accurately one's credentials, professional education, and experiences. A health information professional shall make clear distinctions between statements made and actions engaged in as a private individual and as a representative of the health information management profession, a professional health information association, or one's employer. Claim and ensure the representation to consumers, agencies, and the public of professional qualifications, credentials, education, competence, affiliations, services provided, training, certification, consultation received, supervised experience, and other relevant professional experience are accurate. Claim only those relevant professional credentials actually possessed and correct any inaccuracies occurring regarding credentials. Report only those continuing education units actually earned in the recertification cycle and correct any inaccuracies occurring regarding CEUs or continuing education units. So this is very important, especially to my students that are out there. And I will see them put on their name, oh, well, I'm CCS eligible, I'm RHIT eligible, I'm RHIA eligible. When it comes to your name needs to stay your name until you possess those credentials. If you do not possess those credentials, you cannot put that next to your name, even if it says eligible or even if it says in process. And so that's something that you have to understand when you're in this industry. Sometimes people will look at a name really quickly and not really pay attention to other things because they'll see exactly what they need to see. And that can be misleading. That's where, okay, I didn't know that they were this because I didn't see that other part. So that's why you have to make sure that when you're out there representing yourself, that you are very clear. Now, if you're saying that you are pursuing an associate's degree in health information technology, that's great. And when you're describing yourself, obviously, not next to your name, but when you're describing yourself. Same thing if you're pursuing a bachelor's degree in health information management. Those are things that you can say. If you are a medical coding student, that's something that you need to say. So that's how people can understand what the difference is and where you are in your journey, okay? Because falsely representing yourself, say for example, you have the CPCA. I have heard of some people on social media say, oh, just take off the A so they'll call you back for an interview. That is wrong. And that is the fastest way for you to get denied in a lot of places, because if you have the Certified Professional Coder Apprentice, and that apprentice designation is for those who have less than 2 years of work experience as a medical coder, and so there's a 2-year requirement. There are ways to accelerate the removal of the apprentice status on the CPC. However, you still have no experience, okay? Even if you accelerate the removal and you're a full-fledged CPC, it does not mean that you're going to be better off because you still have no experience. It's still going to require you to be very proactive when you're out there applying. But you must be honest, and if you have a CPCA, you must designate yourself as a CPCA. And at no time can you remove the A until it is officially removed from the American Academy of Professional Coders, okay? That's something that you guys have to be very honest about that. And if you say, well, I'm honest about not having experience, there is a difference between being honest about not having experience and harping on it, right? Versus, okay, well, these are my credentials. Your credentials should always be clear. There should never be any like question about what you have. For example, myself, I started out with the CCA, the Certified Coding Associate, and that is a credential with the American Health Information Management Association. This says I have entry-level competence to code for inpatient or outpatient coding. I kept this credential for 13 years because I was tired of people saying, oh, CCA this, CCA that. I wanted to show them, okay, let me show you what a CCA is capable of. And I changed lots of hearts and minds about it. And so that was my contribution, of course, to that credential. I would still have it today if I could, but I can't. The second I got a higher level certification, according to AHIMA, if you get the CCSP or you get the CCS, and you have the CCA, your CCA gets what's called superseded. What does superseded mean? Superseded means that as soon as you go to the CCSP or to the CCS in this situation, that the CCA is, you no longer carry it because of the simple fact that you have a higher level certification and that you no longer need it, okay? So from then on, from that day, from when I got it in March of 2021, I could no longer report that I was a CCA. I had to take that off and say that I was a CCSP because that was my credential, and that's the way that it is. However, if you get an RHIA or an RHIT and you get the CCA, you can still retain the CCA because that's medical coding certification is different from the degree designation, all right? So hopefully that makes sense. But you will be able to keep that. Now, if the RHIA or the RHIT, when it got the CCSP or the CCS, that CCA would be superseded, okay? Because you have a higher level medical coding certification according to AHIMA. So that's how that goes. Now, if you see somebody that has a CCA, CCS, this is wrong. And some people will try to do this. Do not do this because it shows that you have no idea what you're doing when it comes to these certifications, because it specifically tells you on the AHIMA website, when you get that higher level certification, that you will not report that CCA, that you will report either the CCSP or the CCS, whichever one that you got, okay? So always make sure that you are representing your credentials correctly. And even though you say, well, Blue, I earned it. Yes, you did earn it, just like how I earned it. However, that's something that in this industry, you have to be able to show rightly what you have at that moment. If somebody was to call and verify for me, and I said I was CCA, CCSP, and CCS, they would say, okay, well, we're calling to verify credentials. You know, what does she have? They'll say she has a CCSP and a CCS, not a CCA. And of course, you have to go back to the rules and look at that kind of thing. So that's why I say you have to be very careful when you're representing yourself, because it's going to make you look incompetent if you don't know how to put your credentials on your name, okay? Now, the other thing is this. If you have a degree designation like the RHIA or the RHIT, and let's just say you go from RHIT to an RHIA, it's the same deal. That RHIT would be superseded once you get that RHIA, okay? Because the RHIA says you have the bachelor's degree. There's no need to say that you have the associate's degree designation for health information when you have the bachelor's degree, okay? So that RHIT would be superseded. You should never see RHIA and RHIT in the same line, or RHIT and RHIA. You should never see that on the same line, okay? So you have one, right? You get that RHIA. Now, let's say that you have the RHIA and you have the CCS, okay? Which one of these is going to go first? It's going to be the RHIA because that outranks the CCS, okay? It outranks the CCS as far as education goes. It takes a lot longer to get that RHIA as far as like the education to be able to be qualified to be able to sit for that exam and than it does with the CCS. So that's why it goes degree designations first and then your specialty credentials, okay? So that's how that's going to go. Now, if you have, let's say you have one credential that's a CPCA and you have the CCS. Now, there's some schools out there that will push their students to get both certifications, which you do not need, okay? You do not need them both, but they will push you, oh, because you'll make more money. You will not, okay? Because they say different things. Now, the CCS says that you have mastered inpatient coding and outpatient coding. The CPC or CPCA says that you only know outpatient coding. It tests you nothing on the inpatient side. It tests you nothing on what is it, ICD-10 PCS. It does not test you on that at all for that CPCA or the CPC. It does not test you on that. So when you have these two certifications, the CCS should always go first before the CPC or the CPCA. Why? Because the CCS has more distinguishing topics in it as far as like that you have mastered inpatient coding and outpatient coding. And that is more than just knowing outpatient coding. Your competency shows that, okay, you have inpatient coding and outpatient coding experience, and you also have outpatient coding from another association. Now, again, you don't need them both as far as like it just to get out there and start applying. You do not need them both. And again, a lot of schools will try to push that. And think about that, guys. Schools are a business, all right? They are a business. And I see a lot of people being taken advantage of because of that. Because they want to, oh, they have to buy all of these things. No, you don't. All you need is one, okay? Let's just say you get a CPB. I've seen this before too. CPB, CCS, CPC. Wrong. It should be CCS, CPC, and then CPB, okay? Because again, you're going more towards what level of competency do you have? Now, some people may say, well, Blue, I'm a biller, so I feel like the billing should go first. Again, if you want to, that's fine. But to me, the way that I would do it is coding and then reimbursement, all right? But if you want to go CPB, if you want to go CCS, CPB, and then CPC, it's up to you. But this, I'm telling you how I would sequence it based on competency and then based on, okay, all these other things. And then I've also seen CBCS, somebody got a CBCS, and then they put, what is it? CCSP, and then a CPC. Okay, CBCS is not asked for as much in the industry as a HEMA and AAPC credentials. When you're out there and you're looking for a job, do not get your feelings hurt. Don't get your feelings hurt, okay? This is really real and true the way that the industry works, okay? When you look at the job listings and they show you, okay, well, what credentials are they looking for? A HEMA and AAPC all the way, all the way. So when you're out there and you say, okay, well, you know, I have my CBCS, that's not what they're looking for. That's not what they're looking for. And the reason that a lot of them don't look for that is because a few years ago, and I keep saying this, but I want y'all to understand this. A few years ago, the CBCS, or the Certified Billing and Coding Specialist certification, did not require you to have the medical coding manuals. It was basically a memorization test about reimbursement, right? Because you're doing a lot of things from memory. Now they read the test and you have to have books, right? You have to have your coding manuals. Okay. So I guess they're trying to level up their credential, which that is great. But again, that's not the industry that we are in. That's not the industry the way that they think. It takes a long time for things to change in the health information industry. Okay. It does. It's not a quick overnight thing. Okay, so it's going to take a little while. Me personally, I would sequence based on the specificity of that credential. Okay, so I would go with the AHIMA credential first, or the AAPC credential, whichever one you have, right? And then go with the CBCS at the end if you insist on carrying that. Okay, so there's just something that you got to think about. And I'm not saying these things to put anybody's credential down or anything like that. Certainly not. But I don't want people running around with their credentials all messed up and out of order in all kinds of funky ways because they think that they don't know, or they're just, they just didn't even think about it. Okay, it's about professional representation. How are you representing yourself? So again, your degree designations go first. If you are a nurse, if you are still a nurse, right, an RN, you're going to go RN, and let's just say you got your RHIA, and then let's just say you got the CCS, just like that. Why? Because again, with the nurse designation, right, you do have your degree, but there's also licensing that goes into that and all kinds of things. So that's why I say RN can go first, RHIA, and then CCS. Okay. If you have the CCSP, which is the Certified Coding Specialist Physician base with AHIMA, and let's just say that you also have the CPC. And so you have two designations that both say the same thing, outpatient coding. You can pick either one of them to go first because they are literally the same thing, but just different associations. The exam looks different as well. So they test on a little bit of different things, but for the most part, it is outpatient coding. So you can pick either one to go first, but look at your credentials, okay? Don't try to put more credentials on your name than you absolutely have, okay? If you have the CCA and you end up getting the CPC. Now, these are two different designations. These are two different associations. And again, if you have the CCA says inpatient and outpatient coding. If you have the CPCA, that says that you're an apprentice outpatient coder. So which one of these two do you think should go first? In my objective opinion, okay, in my objective opinion, because this is not subjective where I'm thinking, okay, I'm looking at this objectively. This person that has the CCA knows about inpatient coding and they know about outpatient coding. So versus a person who just has a CPCA who only knows about outpatient coding. So to me, which one is more academically, like more to that certification? That's the CCA. Even though it says entry level, you're both at entry level right now with the CPCA and, with the CCA. I would sequence the CCA first, and then I would sequence the CPCA. Okay. Again, you do not have to have both of them, but if you are saying that you are competent to code inpatient coding, which is at ICD-10 PCS, then you want to make sure that that designation is standing out with that CCA, okay? And sometimes people will get the CCA because, they're just barely starting and, they're not really sure of themselves. So they say, let me get the CCA first. CCA first. Let me get that one first. And then let me see how I do on that test. And then I'll know if I'm ready for the CCS or if I'm ready for the CCSP, okay? And so they'll do that, okay? But again, because that CCA knows more than that CPCA, that's why you, according to the credential, okay? Now, somebody who takes the CPCA may also know that inpatient coding side, but they didn't test on it, okay? But that's why I say that CCA would go first before that CPCA, all right? And that's how you figure out how to sequence these certifications, all right? Now, when you talk about the specialty things, it really all depends on what it is. And when you start piecemealing a lot of these certifications, it gets kind of murky. But it's all up to you. But when it comes to the main medical coding certifications and the degree designations, that's really kind of how I would distinguish them. All right. And then it really depends on, like, if you got the CDIP, right? If you get the CDIP, how would you sequence that? Well, again, it all depends on which certifications you have. If you have if you're an RN, and if you have the RHIA, or if you don't have an RHIA, just you have an RN and you have a CDIP, it would go RN, CDIP. If you have the RHIA, it would go RN, RHIA, and then CDIP, okay? Because the CDIP is much more specialized. So that's the way that you would sequence those. But you never, ever put your name, comma, and then your RHIA eligible, or your CCS eligible, or your CPC eligible. You never do that. Never. You only put the credentials on your name once you've acquired them. Once you possess them, then you can put that, because it's all about being very transparent about what you have and your education status, because believe me, guys, they will find out. And we do have to have our credentials confirmed. I mean, even for myself, I have to report my credential number so they can do the credential verification from time to time. They will, honestly, they will do that from time to time. They will check to see, your credential status, if it is still current, or if, whatever the credential status is. So you have to make sure that you're always being honest, and be proud. If you have a CPCA and this is your first time in the industry, it's okay. It is okay to have a CPCA, just like it is okay to have a CCA. The thing that gets most people is that they get very impatient. They don't want to wait to find a job. They get very discouraged because they say, oh, no one's hiring me, no one's doing this. You have to keep applying. You have to keep applying. You have to have the right resume. The resume is on one page, and it is talking about all of the skills that you gained when you were in the school or when you were self-studying, okay? You can look at the job listings and see those, what they're asking for, what that employer is asking for. And sometimes it takes 6 months, sometimes it takes 9 months, sometimes it takes a year to find a job. But it's not impossible. But if you are constantly like getting down on yourself, like, oh, I can't find a job, it's because of my credential and blah, blah, blah. It has nothing to do with your credential. It has everything to do with you and your ability to be able to showcase your knowledge base and how you're presenting yourself. If you're presenting yourself as competent, you will have much more chances to be able to get in. However, if you are not, and you are showing your credentials all kinds of willy-nilly ways, and you're doing all kinds of things to cut corners to try to get in, or you're giving out 3 or 4 or 5 page resumes, that's your problem. That is the problem right there. It has nothing to do with the credentials, because anybody with any one credential can get a job. Anybody. And I know that for a fact, because I went through this. I went through this as a brand new CCA. I went through this where I got many rejections, and I didn't know why, because of course they didn't tell you. But if you're doing your research and you're finding this stuff out now, you're like, okay, you're ahead of the game. But it wasn't until I started listening to really good advice. And that good advice came from my mom when she told me to go back to the school and ask them about, do they have any connections on how to find a job, or what can I do? Went to the school. The principal said, oh yeah, I have a friend who owns their own temporary agency. And of course, I didn't want a temp job. I want a real job. And he said, for every single assignment that you go on, that is filler for your resume, that gets you exposure to the industry, and you can have more experience, you make more connections, and that's how you get your permanent job. And sure enough, I went over there, I took my test, because they give you an assessment test to see what you know, to see if you're competent. And sure enough, I got my first assignment within a week. But it was for 3 months, and they said, after this 3 months, we're going to pick one person, because they picked 3 girls, and they said, we're going to pick one person to stay, and then the other ones, good luck to you. Well, I was told good luck to you. And that's okay, because again, the person that I was working under wasn't the best, okay? So I was fine with that. But then I got another assignment that they said they guaranteed me for 5 years. Well, guess what? I stayed there for 8 months because I was actively applying to get back to my hometown because I had to move away. And when I was applying, and sure enough, I got it. So within less than a year, from the time that I started to the time that I got my forever home job, it was less than 1 year I was able to get my forever job. And I have been here. I just passed my 15-year anniversary here. So it is possible. And I did that with a CCA. Never once taking no for an answer where, oh no, Blue, you won't be able to do that. Oh, really? Oh, no, you shouldn't apply. You shouldn't waste your time because they won't hire you. Oh, you think so? Let me show you something. So, sure enough, and I will say that over and over again, okay? And that's one thing that I will tell you guys is to stay encouraged and stay motivated. And I will not allow anybody on my social medias, any of my other ones, LinkedIn, Facebook, YouTube, I will not allow anybody to have that self-defeated behavior or that discouraged behavior or attitude. I will not allow that because I know better. I've been there. I've lived it. Okay? So I will not allow anybody to talk about themselves badly. So if that is you, think twice. Okay? Think twice before posting that comment because no, we're not dealing with that. No, and not at all. Not at all because y'all are better than that. Y'all are better than that self-defeated attitude. Y'all are better than, oh, I can't do it. Yes, you can. Every single time and twice on Sunday, I will say that same thing. Yes, you absolutely can. With that said, I'm going to wrap this one up. Thank you guys so much for joining me. And I will leave a copy of these Code of Ethics in the description box so that y'all can see it, that it is literally right there in black and white. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.